Very good morning, everyone. Good morning. Can I hear a good morning? A loud and clear good morning from all of you, everybody. Super, very nice. All right, so I'd like to welcome each and every one of you. Firstly, I'd like to take this moment to thank all of you for having joined us here on time. Thank you so much for joining us, and especially to all our speakers who are going to be presenting today. Well, ladies and gentlemen, this is the 8th World Congress on Gerontology and Geriatrics and the 6th World Congress on Infectious Diseases and Antibiotics, organized by the Biogenesis Health Cluster Conferences. Now, to talk a little bit about Biogenesis, now it was founded in the year 2011 by Dr. V.P. Rao, and Biogenesis Health Cluster's aim is the coordination and execution of work done by researchers across the world on initiatives designed to help international development in the field of healthcare, education, science and technology, particularly through aid to developing countries. Now, Biogenesis Health Cluster is a think tank organization performing constant, continuous research activities and carries out work in various areas. The services rendered by Biogenesis Health Cluster Conferences are they conduct workshops and conferences, clinical research, regulatory affairs, global marketing for life sciences, global business, and research and development. Ladies and gentlemen, everybody, let's keep the applause coming in. Filling in this amazing day with lots of positivity and light.
गणनाथ प्रभु संकट हरणा भव भय हरणा संकट हरणा भव भय हरणा वेद विधायक मोदक हस्ता वेद विधायक मोदक हस्ता विद्यादायक हे मम बन्धो विद्यादायक हे मम बन्धो गजवदना.
All right, to the dignitaries on stage, can I ask all of you to surround the lamp for a picture, please? Can you come closer for a picture, please? Everybody, let's hear it up with a big round of applause to all the dignitaries on stage. Thank you very much for doing the honors.
Sorry, I may not be able to read because I have some eye problem, and I request my colleague Nicole to read my message to you.
Thank you very much, sir. It's my absolute privilege to be doing the honors. All right, so in the words of sir, it's my honor and privilege to welcome you all to the 8th World Congress on Gerontology and Geriatrics 2025, held in conjunction with the 6th World Congress on Infectious Diseases and Antibiotics 2025. Now, this gathering marks an important moment for all of us who are committed to advancing global healthcare, strengthening research, and improving the lives of people worldwide. The significance of the Joint Congress lies in the intersection of two critical areas: aging and infectious diseases. Our world today faces a dual challenge: an expanding elderly population and the constant emergence of new infections. Now,
Thank you very much for rekindling a person who's been in the backwaters for some time, and to speak on a subject which is of very great importance. That is infectious diseases and antibiotics. Let me start with antibiotics. When I started microbiology in the early 60s, at that time, it was unimaginable that anything that could have changed the face of medicine so significantly. Though I belong to the post-antibiotic generation, I did interact with people who had seen infectious diseases in the pre-antibiotic era. And they were always amazed at what was achieved at that time. It's one of the major discoveries, or one of the major advances that occurred in the 20th century, were the introduction of antibiotics. At that time, there was a great euphoria, and one had the feeling that one had conquered infectious diseases. And in fact, at the time when I joined the service and did opt for going into microbiology, my commandant at that time, he said, "Lad, you've done so well, you can choose any specialty you want. Why do you want to get into this?"
The well-being of our elderly must become a collective social movement, not a solitary struggle. When I was in Raj Bhavan in Dehradun, Uttarakhand, there was this lady in her mid-30s who was not married but had one mission: care for the elderly. She came to me, and with a few others, we set up a daycare center. Not a care center, but I would say a club where senior members registered. They had
Vaccination is preventable. Prevention is any day better than cure. Okay. Now look at this picture what I put for you. Although India is the 5th richest country or 5th largest GDP country in the world, but we're still constrained in terms of spending for health. India spends about less than 2% of the GDP, okay? And, but look at the other BRICS countries. Japan spends about 10, now US spends about 20 to 18 to 20. But look at Brazil, 3.9, and China, 2.9. So we are lagging behind. So what does it tell you? It tells you that if you have any vaccine that you have to use, please use it. Because India cannot afford patients going into the hospital. You've seen a lot of patients who go as crorpatis come out as roadpatis. You know, so expensive. Medical bankruptcy is very real, okay? Okay, now, how bad is a pneumococcal disease? There are about 3 million deaths annually because of community-acquired pneumonia, okay, which is totally preventable, okay? Now, there are about 150,000 hospitalizations occurring in the US. The problem in India is the data is very sketchy. We know that 15 to 25% of all community-acquired pneumonia or streptococcal pneumonia, and a lot of them have a resistance to penicillin. Just playing up. Okay, now how about India? Quarter of the world burden of pneumococcal disease and 1/3 of regional burden of pneumonia happens in this country. That's a huge number for us to ignore, okay? Now, pneumococcal disease is common among younger people, middle-aged people, and older people. But look at the figures down here. 60 to 70% of older people who get this infection get admitted to hospital, okay? It's quite brutal in older people, okay? Now, streptococcal pneumonia accounts to 1/5 to 1/3.
Today, I'm just going to give a small report about this quercetin, how it plays an important role in controlling the bacterial proteins and in periodontal infections through docking studies. So this periodontal disease, as you all know, how the teeth looks in the normal, in the mild state of infections, in the moderate as well as in the severe. So this bacteria, namely these periodontal pathogenesis is caused mostly by this Porphyromonas gingivalis, Fusobacterium nucleatum, Staphylococcus aureus, and Tannerella forsythia. So these are the major cause of the infectious diseases which has been caused in this periodontitis. And we all know about this gingivitis, periodontitis, and what are the symptoms which differs from each of them. That is, gingivitis, you have a red swollen bleeding gums, whereas periodontitis, you have an advanced stage of the disease with chronic inflammation, which has a response for irreversible destructions of both the tissue as well as the bone. And this must be taken with a proper care. And if it leads to be very severe, it may go for surgical care, where it can be a pre or post surgical care. We may use this quercetin, and we are trying to go for preparing this quercetin into a nanogel form, and we thought of making it use for the treatment of this periodontal diseases.
Percent of the deaths, and diarrhea kills 15% of the children, and 80% of the population are malaria prone in our tropical places. 2 to 2.5 million are malaria infected. Emerging infection diseases in children may cause devastating in pandemic in global pediatric population. I am telling the pediatric perspective. Why humans are constantly looking for new ways to meet the virus? We are having so many causes, that is irrigation, massive deforestation, rerouting, wildlife parks, long distance transport, livestock, etc. Air travel, uncontrolled urbanization. Everywhere there is real estate, breaking the forest, constructing the homes, hot tubs, air conditioning, billions of used items. Blood transfusion, xenotransplantation, social changes with regard to drug abuse and drug dependency.
Testing contacts and post-exposure vaccination, communicate with the LTC and the clinicians. LTC, lab technician. Implement of IPC immediately. Use molecular typing when available to link cases. Report to public health authorities and initiate community measures. Programmatic strategies, integrate screening and vaccination in geriatric clinics, strengthen surveillance and electronic health records, education for healthcare workers and caregivers. Deaths from viral hepatitis relating causes are increasing. 2019, it is 1.1 million. In 2022, it increased into 1.3 million deaths. Here, even though it doesn't cause immediate mortality, in long run, the patient.
Millions of people are dying because of this antimicrobial resistance, where so many antibiotics were available and for treating the pathogens. Now bacteria develop resistance to most of these antibiotics at different extents. And if you look at that, it has been predicted that the number is going to be very high over the times. And if it is not taken care, probably one person could die every 3 seconds. But if you look at another statistic, in the case of only bacteria in 2019, if you say 7.7 million people had died because of bacterial infection, out of that, only 1.2 million people died because of which is directly connected with the antimicrobial resistance. That means there is still 6.5 million people died where the bacteria, this antibiotic is supposed to save the people. Those who have bacteria are susceptible to the particular antibiotic, it's supposed to work. But then why people died? And I call as that the
coronavirus family has been infecting for thousands of years. Hepatitis A infects millions of people around the world. Hepatitis A virus is highly infectious, and the disease can mainly be caused by fecal-oral transmission. Fever, loss of appetite, weakness, tiredness, nausea, vomiting, diarrhea, jaundice, abdominal pain, dark urine, clay-colored stool, joint pain may be the features of acute infection. Increased risk of severe illness from hepatitis A infection can be in persons with chronic liver disease and HIV infection. Patients with chronic liver disease may be at higher risk of severe illness from novel coronavirus infections. There is no specific treatment for hepatitis A viral infection.
From where we discussed the overall global perspective of how dementia prevails and what are the pharmacological and non-pharmacological interventions. So there is a paradigm shift where we address this from a limited resource setting to what we have today in the modern day, where we have ample of gadgets and ample of non-pharmacological interventions coming into picture. So it's more of a holistic and a person-centered care approach which prioritizes well-being and overall improvisation in the quality of life. So non-pharmacological intervention is any sort of intervention that not directly involves a medication. It is to attempt to enhance well-being and to manage the chronic illnesses that an individual is going through. It also manages pain, helps in managing pain, reduction in stress, encouraging positive changes in
This is a cost. Moving on to the statistics, India ranks over 1 lakh deaths per year, and through the worldwide it is over 1.5 million and over 10 million deaths. And so moving on, what is the research problem and the gap? Now the main problem with TB therapeutics is the long drug administration, poor patient compliance and overburden of pills. So what happens is that because of this caseating granuloma, there is a residual impairment of the lungs which increases the chances of reinfection and also the chances of antimicrobial resistance. The antimicrobial resistance is so worse in TB that even the World Health Organization in the published report in the year 2024 has prioritized TB as one of the critical tier 1 phase pathogens. So what are the objectives of our study? So the main objectives of our study was to find an alternative therapeutic regimen to tackle TB with enhanced anti-TB drugs
or bloodstream infections and leading to nearly 1 million deaths every year. Coming to Indian scenario, India bears a substantial burden of serious fungal diseases with estimated 57 million individuals, and recent analysis have shown that Candida albicans is on rise, a very predominant pathogen. But now under that is the non-Candida albicans species, we can see over Candida albicans, that is 26.3% in clinical isolates. They indicate in a shift in the species distributions of Candida infections in India.
Antibiotics, as we know, is called as a miracle drug. It's been said to save thousands of lives. Antibiotics can be classified into two groups, that is bacteriostatic and bactericidal. That is, they inhibit the bacterial growth and kill the bacteria. Antibiotic resistance has become one of the largest and the most serious global crises of our time. It can even be called as a silent pandemic. A Lancet study conducted in 2024 has predicted that if antibiotic resistance continues, this trend continues, it could lead to 39 million deaths by 20.
To identify the gene responsible for it through a CARBAR assay, and to assess the patient's clinical profile and the implication of this resistance on the patient. So what we did is a cross-sectional study over a 6-month period. Microbiological records in the patient detail were reviewed and analyzed. All the CRE, which is carbapenem resistant bacteria, were picked up from the culture report, were analyzed, and in some of the patients we did a CARBAR assay was performed to find out the culprit.
24 hours of treatment. It was done for control, drug solution, marketed as well as the cubosome, prepared cubosome. After 24 hours, we observed that the cubosomes had a better kill, that is reduced in the fungal cells compared to the other formulations. And this is the histopathological evaluation of the ocular. It was done for the bovine eye. A is the positive condition.
It has its own immunity. Medicinal plants, all plants and their antiviral action. See, this is very important. The alkaloids are natural compounds found in many medicinal plants. They help plants defend themselves, and in humans they can fight against viruses too. Some alkaloids like cefalothin and lycorin, they stop viruses from entering our cells.
March 2025. So this is a methodology. Whenever a clinical isolate we receive in a microbiology lab, we subject it to gram stain, and then simultaneously we do it with the culture process, which takes about 18 to 24 hours of growth. After 24 hours of growth, when we get a colony, we just pick it and go for
doses. And the chest X-ray was like that, imaging which was done with left lower lobe and middle lobe consolidation collapse with a non-homogeneous opacities, with non-homogeneous opacity possibly a mnemonic effusion. Then in the ICU, the patient further had desaturated, and we started him on NIV with FiO to 100%, and the saturation was initially maintaining on NIV. And ECG showed just premature atrial contractions.
The non-probability purposes sampling technique among the 55 patients with diagnosis with the liver disease. And patient diagnosed with the liver disease is 18 years and above that included, and those are willing to participate and understand the Nepali, Hindi or English. So this is about the tool. First tool is the background and the socio-demographic
in vivo trial in guinea pig model. And finally, I have also tested histopathological just to confirm whether the formulation is working particularly or not. So you can see this is the morphology of Trichophyton mentogrophyte, and the identity was confirmed by molecular analysis. ITS markers. So this GCMS analysis of Melissa office analysis showed that there are two components which are in major proportion, that is jet citral and geraniol. So these are the two one. And for confirming the shape morphology, the same analysis was done, followed by AFM analysis. Both of these two give the similar result, only due to difference in sensitivity, a little bit difference in particle size. For example, in case of...
So sorry for that, but our effort of doing this is to reduce this prevalence of anemia in pregnancy. So why I take this study, because in almost all are neglected with anemia. But I'm telling you, in 90% of the pregnant women are anemic still. Why? So that is my question for my next, phases of study is coming through, still going on. So with that, I conclude my studies. So please remember.
Category, and from the oral bit of it, we have 3 of them whom we have picked up as the best presentation in oral infectious. And I'd like to call forward Abhishek Kumar Dwivedi to please come forward, Kirti Lakshmi B and Disha Gururaj. Abhishek Kumar Dwivedi, Kirti Lakshmi B and Disha Gururaj. Can we have the 3 of them up here on stage, please? Do we have Kirti Lakshmi B and Disha Gururaj? Congratulations, Mr. Abhishek. Next up, from the poster presentation, we have picked the best 5 of them, and I'd like
you, the delegates, the speakers, who made it possible, who made this such an important, interesting, enjoyable experience. We did discuss, we deliberated, we learned, we have questions, we have food for thought to mull over. And thank you for each one of you for bearing with us, and especially also thank the Baptist team. You've been amazingly lively and clapping and cheering the speakers and others. So I also want to thank Dr. V.P. Rao. Could you just give a big hand of applause? And if not for him, Radhika. Radhika, she's in the background as always. Yes, she's the one who runs the whole thing. And the team of people with Dr. V.P. Rao and Radhika. And also Nikhil, Nitin, give a hand for Nitin. Nitin is a quiet boy, works behind scenes. Shakila and Akshay Kumar, yes, they all are unsung heroes, unseen heroes. They're the ones who made